If you recently had total hip replacement and are still struggling with hip pain after the surgery, I'm going to share with you 3 tips to instantly reduce your pain symptoms that don't involve pain medications. Tip number 1. Now, we all know that you have to elevate the leg, you have to ice the hip. One specific thing about icing the hip on that surgical side that patients aren't always aware of that can actually affect their pain and improve it is moving an ice pack around the whole joint. So a lot of times patients will only focus on icing directly over the incision. But if your ice pack isn't big enough to cover the entire hip, which a lot of patients that I've seen, they usually use like a square or a rectangle ice pack, which only covers small portions of the hip. And obviously it depends on like body size, hip size, and all that stuff. But for everyone, you can still find actually good effectiveness in reducing pain by moving your ice pack. So you can focus on working the lower part of your hip, the thigh, the upper part of your hip, the side, and even on the back side of your hip. So for patients who had an anterior approach for the hip replacement, icing the back of the hip can also improve some of the pain symptoms that are associated with the hip joint itself. So that's just one of the things that you can start to try if you find no real improvement of your pain symptoms, or if pain is starting to travel to different areas of the hip. Move that the ice pack around all over the hip and the upper thigh, because that may improve some of your pain symptoms that you've been having and you just haven't been able to address it just because you've been using a smaller ice pack on a smaller area. And this may be one of the things that helps you a lot, because a lot of patients that I've had actually found some relief by using this technique. Tip number 2 is trying to move a little bit more often. Now, specifically, one of the things that I recommend for a lot of my total hip replacement patients is, because you're going to be more sedentary, because you're going to be lying down more and icing more, what I try to recommend is every hour, because you're going to be taking breaks of the ice packs, you're going to be replacing it with a colder one, you're going to be taking it off, you're going to be taking it off when you walk, when you go to the bathroom, when you change rooms, change positions. Before you walk, before you change positions, one of the things that I like to add is essentially every hour while you're lying down, try to work on some heel slides, try to work on some movement at the knee and hip joints, some very low effort, low stress movement. So you're not trying to work on a really big stretch or anything like that. This is just a small movement just to loosen up the joint, trying to reduce some of the joint stiffness and some of the tightness of some of these muscles that get put in these shortened or contracted positions for long periods of time because you have to be more sedentary. So pretty much every hour, working on bending the hip, bending the knee in small ranges of motion, trying to do a small number of those before a person gets moving, before they change position, can really help reduce some of the hip pain that's secondary or related to joint stiffness or muscle tightness. So if you've been struggling with your hip replacement recovery, I created a list of some of my favorite Amazon products that I recommend to my patients to help facilitate their recovery. Some of the things that this includes are like ice packs that are specifically designed for the hip joint after surgery. So I'll leave a link to that in the description and the comments below. I'll also leave like a QR code on screen, so you just snap a picture of that and you can just follow the link to these products. Now, the third tip that is often not actually used enough, because people find that using the walker kind of gets in their way, or they just simply don't want to use it, but specifically is within that first 7 days after surgery, I always try to recommend for my patients to use that walker, use their upper body to offload the weight off of that hip joint as much as they need to. So when they're standing up, when they're walking in their home, they may feel like they're stable, they're safe enough or confident enough to walk without it, or to walk with barely using it, or having the walker very out in front of them. So it's kind of not in a position to be used for offloading purposes, but that might increase their pain and inflammation symptoms just enough that it persist, right? Maybe their pain levels are on a lower end, so 1 to 3 out of 10, and for them that may be tolerable enough that they feel like they don't even need to use the walker. But if they use the walker, offload the hip, maybe their 3 out of 10 could be a 1 out of 10, or their 1 out of 10 would be 0 out of 10 if they offloaded that hip in that first week a little bit more. So if you're within the first 7 days of surgery and you're wanting just to get rid of the walker or not really use it, and you still have some pain, really try to use that walker to offload the hip joint, and you may find yourself having a little bit less pain than you did before.